Thank you very much. Really appreciate everybody joining. So this is the second time we've done the Zoom call, and again, your feedback very much appreciated. We did get some comments back from last week that people did find it helpful. So we'll continue to do what people say is helpful in terms of getting messages out to as many people as possible. So we've got some slides that Oliver is going to take charge of. So if you go through them, Oliver.
Yeah, so I'm just going to... I've forgotten to screen share, so bear with me. Gonna get that up right now. There we are. Can everyone see those?
Yeah, I've got them, so hopefully everybody else can see. So if we just go down to the next slide. So obviously, I'm Sarah. I'm the Chief Exec for people that have joined the call that didn't join last week, that have maybe not met in person before. So this is a 30-minute meeting. The technology means the way it works is it'd be really difficult to make it a two-way conversation. It would be very difficult for us to manage that. But we have got the chat function, as Oliver said. And any questions, anything that you want us to pick up in future communication or to have a bit of a focus on next week, please just drop us a note through the coronavirus inbox, and Oliver and his team are keeping an eye on that and sharing the queries and the questions that are coming through. So this is a live chat in Zoom, but it's really important that we are mindful not to divulge things that are personal or confidential, just to make sure that we're keeping in line with our IG requirements. And as we've said, try and keep yourself on mute. Otherwise, if you're at home, we get to hear everything else that's going on in the background. And sure, some of you might not want that to happen. So if we go on to the next slide. Thank you. So hopefully many of you got to witness this and be part of this yourselves last week. This was the most overwhelming show of support for the NHS that I think that we've ever seen. People remember that the NHS was a bit of a theme when it was the London Olympics many years ago as part of the opening ceremony. I think what really came to light last week and continues to be shown day in, day out is the scale of appreciation for what the NHS actually does, and a real sea change in terms of public support. That's really important, and I hope all staff took that on board, because you are the ones that are coming into work day in, day out, or changing your working patterns to continue to support our frontline services and looking after our most vulnerable people in such an unprecedented time of the national pandemic. And we just really want to echo that thank you on behalf of the board. So the first thing to say, and this is just to keep reiterating, your safety and the safety of our service users remains our #1 priority. And when I talk about safety, that's about doing everything we can so that you are not personally at risk of contracting COVID, and in the way that you're going about your day-to-day business, whether that's in terms of looking after your family, loved ones, getting to and from work, really make sure that you're keeping yourself safe. You'll know hopefully through the comms some of the work that we've done to help with that. So staff that rely on public transport, if you need to use a trust taxi, that is available to you, because we don't want people feeling unsafe getting to and from work. For staff that are on duty in our inpatient units, again, the provision of meals, so you've got a hot meal whilst you're on duty, not having to worry about needing to get off the ward for breaks. And any other ideas that people have got of the more that we can do, please just let us know. We're open to all ideas, and the workforce work stream is meeting on a daily basis, and we'll respond to those. Incredibly grateful for all the fantastic work that everybody's doing and the way in which everybody has adapted in such a short space of time. You recruit already, Oliver? Is that your little girl coming to help us?
Yeah, everyone say hi to Beatrix.
Hello. You come to see what your daddy does.
Hey. Oh yeah.
And there you go. There's another sign of how we're adapting, of having to really find a balance between the impact of the lockdown on our personal circumstances and doing what we can in order to fulfill what are really important roles as well. Again, I said last week, you know, some of you that use social media, please keep those stories coming. These are really important of boosting morale, maintaining that sense of team and sharing those examples. But again, just look after yourselves, because this is going to be for many weeks, if not months. So just in terms, if you want to go on to the next slide, Oliver. So what's happening regionally and nationally? So vulnerable people are getting letters direct in terms of the implications for them if you've got certain conditions. The message to everybody else is still to stay at home where you can in order to save lives and reduce the spread of the infection. In terms of what's happening across the country, we know that at the moment the highest rates are still being seen in the south of England, in London in particular, but the rates are starting to increase in the Midlands and over in the northwest. So it's only a matter of time before we start to see increased rates in our own region. So the prediction at the moment is that we'll probably start to see moving towards the peak around mid to the second half of April is all the modelling that's been done. That's modelling based on what we know now. It's not perfect science because obviously the figures are changing day in, day out. So we're still in the phase of doing all we can to reduce the spread of the infection. And I'm really reassured to be able to say we've still had no positive cases in any of our inpatient units. That's not the norm. Across the West Yorkshire region, all the other trusts now have seen cases within their inpatient units. That tells me that, you know, our staff are doing everything that we've asked them to do. You are all doing everything we've asked you to do in terms of best infection prevention and control guidance, keeping yourselves and your patients safe. I know we've had to put in some strict measures, but they're clearly keeping our environment safe and keeping our staff and patients safe. And so we just need to delay our exposure to the virus for as long as possible. We know the wider public are worried about the financial impact and support packages are being announced. Our commitment from a workforce point of view is to make sure that staff still are getting the right support from us, but also including our bank staff. If people are poorly and can't come to work, that we continue to pay them. We don't want people to suffer financial hardship as a consequence of the COVID outbreak. We've already got a 24/7 helpline in our region, and again, what we're planning for is an increase in demand for that, so whether we need to increase the capacity in that helpline for the general population. And I'll just talk briefly about the Nightingale Hospital. So again, you'll have all seen the news like I have about those that have been announced. We are planning for one in our region and I expect that will be made public shortly. And we are looking at working with the acute colleagues that are developing the model for that hospital as to what the mental health and learning disability support would need to look like, recognising that patients will have mental health needs or have learning disabilities that are accessing those beds, as well as the support that we need to provide to staff. Testing for staff has been a real issue, as you can imagine, up and down the country. We have had confirmation that the testing regime is being rolled out to staff, and I've just had a further update today that they're going to widen the guidance as to which staff should be prioritised to get access to those tests. So the capacity for testing staff is very much dependent on the overall capacity for testing full stop. I've got a meeting on Friday with fellow chief execs in Leeds. Leeds Teaching Hospital hosts the lab for our region. So as part of that conversation is how do we get access to testing for our staff through the lab at LTHT. So as soon as I know more about that, we'll be able to send further information. And the other area where we're working closely is with our West Yorkshire colleagues at Bradford, Swift and LCH on areas where it makes sense for us to work together around our approach to our workforce, whether we need to look at supporting each other with service delivery if we start to experience reduced capacity to deliver our services. Nothing's changed yet. This is all conversations we're having so that we've got the best possible plans in place should we find ourselves needing to enact them. Next slide, please, Oliver. So what's going on in the trust, and again this is stuff that's in our daily briefings that Oliver and the team send out. So our priority services are all operating well. Staff are doing a fantastic job in terms of safely staffing our services. Those of you that are part of our community-based teams will know that we're changing the way that those are being provided to reduce the amount of face-to-face contact as much as possible. Last week I talked about the decision we've taken to launch Care Director on Monday. Our project team were in all weekend getting ready for us to do the go live, which I'm pleased to say went as planned on Monday morning. We're receiving feedback as to how that's landing with our teams, and the support will continue to be in place to support that rollout. Some very specific changes that we're planning. So we made a number of decisions about reconfiguring some of our inpatient provision so that should we be faced with COVID positive patients being admitted into our units or developing COVID symptoms, that we can care for them in the safest possible way, whilst also protecting the rest of the inpatients in those wards and staff. So there's key changes that we're currently now doing the work behind the scenes for. The learning disability service users that were in Parkside Lodge are being moved to other locations. The service is still being provided, but we're going to move some of the service users into Woodland Square, the respite unit, which we stepped down for the time being in agreement with the local authority. That frees up Parkside Lodge, and we're going to move the mother and baby unit across there from the Mount. In order to, obviously we want to protect the mother and baby unit, but also free up capacity at the Mount to create a separate ward in where we can take admissions if we're asked to admit people that have got COVID. So the older adults team are doing a fantastic amount of work of designing how those wards would work, and also what staff and resource we're going to put in there, staff that have got additional skills in physical health to care for that group of patients. Still all in the planning phase, but this is just to reassure you there's a huge amount going on. The same at the Becklin and the Newsom, of where we can create separate areas if we know that we're getting COVID positive patients admitted, in order to keep that cohort in and protect the rest of the population and staff as much as possible. As you would expect, we are having to change and update all of our own guidelines and respond to national guidelines. All of those are going on the website. There's a lot to digest, so please, when you get the time, look at the changes we're making to our standing operating procedures, for example, around the use of PMBA, changes on guidance around resource to protect our staff in the event of somebody being positive with COVID. And we're also continuing to roll out training to those staff that need it in order to support them to have those skills and know how to respond. Thank you very much, Oliver. If you want to move on to the next slide.
Thank you.
So what's our focus for the next week? So again, we have daily reviews of the work that's in progress, and those daily reviews continue through the weekend as well, just to make sure all our sites are well supported. All of that estates work to support the move of the inpatient wards is taking place, and that cohorting work and what that means in terms of operational procedures for our staff. We're establishing an ethics group, and just to explain what that means, what we know is we're starting to move out of normal ways of working. So just moving cohorts of patients around means that we're asking our clinicians perhaps to practice in a different way than what they're used to. So we want to create a safe space to look at what are the implications of operating under this new guidance in emergency conditions that gives staff the safe space in order to explore decision making. And where we know that will really come into effect is if the changes in the Mental Health Act are enforced. Again, that's a big change in how we operate under the legal framework of the Mental Health Act and the Mental Capacity Act. But what we've got to make sure is that we absolutely protect our most vulnerable people at all times, in spite of those changes. And our clinicians really need safe space to be able to work that through. And that's the work that Claire Kenwood, Tom and Sophia are actively involved in, as well as many others from across allied health professionals as well. We are doing quite a lot of work to make sure that PPE is getting to every place where it's needed. We've had significant rollout of PPE this week. Unfortunately, in some areas it's gone missing. You know, that's really difficult for staff in terms of putting the equipment where it needs to be. But then supplies not lasting, even though they've not been used. So we're just asking each site, be clear where it is, but make sure it's secured safely so that it's there when staff need it. We've not identified any shortages at the moment. This is just us logistically getting our supplies from the storage out to each of our clinical sites. We have picked up some concerns from our Interserve cleaning staff, understandably. They want to feel safe when they come to work. They want to know that they're operating in a safe environment and what they need to do differently on our wards if there's somebody with COVID. So we're giving some training to our Interserve staff, and a real plea to our inpatient areas, make sure that you're giving them daily briefings if there's any changes on your ward with suspected COVID patients, or when we reach the point of if we do have somebody with COVID, keep them as part of the loop. They're an absolutely invaluable part of our workforce, and we've got to keep them safe in our working environments. We've been rolling out smartphones and laptops to enable people to work remotely, and the smartphones we're getting across all of our inpatient wards for patients who now, because we've reduced visiting and restricted it in most areas, can continue to have contact with family and friends whilst they're an inpatient. So a huge thank you to everybody involved in getting that rolled out. And for those of you that are accessing remotely, we have been moving the majority of our coronavirus information onto the Trust website so that it's openly accessible. You don't need to go through the intranet in order to access it. And in terms of health and wellbeing, we had a suggestion about setting up a closed Facebook group for staff. So Oliver and his team are looking at setting that up. We all know social media can be both a blessing and a curse. So we just need to make sure that that's used in a way which everybody finds helpful, because that's the intention of it. It's there to support and be another way of keeping everybody in contact with what's going on. Health and wellbeing is really important.
It's going to be done in 4 minutes.
And well, you're okay. Health and wellbeing is really important, and there's a lot of national products, apps, guidance being produced for the general public at large. I just want to send the message out to our staff across all of the organisation. You're already doing a fantastic job. We've got the skills to be able to plan and manage through the incident that we're currently facing ourselves with. We need to make sure that we're supporting one another and giving each other that supportive space and showing compassion, because we're balancing this between our personal and our professional lives. But we also need to take a huge amount of pride in everything that's already been achieved. And there's a lot to be proud of already, and no doubt there'll be a lot more to be proud of. And there'll also be a lot of lessons learned. We're not going to get all of this right. We're going to make mistakes. You know, we're only human, and we're all working in uncharted territory as we take each day as it comes. Do you want to go to the next slide, please, Oliver? So I think I've just covered some of this in terms of hugely appreciative for everything that everybody's doing. Please keep your personal health, safety and well-being at the centre of everything that you do. That's the biggest contribution we can make across the whole of society at the moment. Let's keep the communication lines open. Whilst we're stepping down on things like appraisals, we need to step up on safe space supervision, MDT meetings, huddles, whatever it is you have in place within your team or your place of work. Really ramp that up in terms of keeping in connection with one another and just being able to talk things through and give each other that positive feedback, because everybody's doing such a fantastic job. We need to make sure that every day we're showing appreciation and thanks for the fact that we are managing to do such a fantastic job in difficult circumstances. I don't want people cancelling their leave. Time off is really important. Your days off are really important. You might not enjoy it as much if you're stuck at home with kids and dogs and God only knows what else, but that mental switch off from the job is more important now than it's ever been. And like I say, we are not expecting anybody in our plans at the moment to have to be cancelling leave. Follow the rules. That's the stuff I've reiterated. They're all out there for everybody to read and to know, and I don't need to repeat those to you. And just you know, a reminder, we're going to be working like this for a number of weeks, so please get in touch if there's more that we can do to support you, whether it's through the messaging we're sending out, the resources, practical things that we can do just to make it easier for you coming and going from work or whilst you're in work. Then please just get in touch, because like I say, we're open to all ideas and we'll do everything that's within our gift in order to support every single one of you. To say a huge thank you for dialing in today, and thank you everybody for the fantastic work that I know that you're doing every day of the week and twice on a weekend. So we've got a couple of questions that have come in that relate to making Zoom accessible to some of our clinical services, in particular our DEFCAM service has asked about that. Great question. We'll take that in through the operations group in order to explore that and get back to the DEFCAM service. And we've also had a question there of somebody concerned about our approach to redeployment. We are going to be writing out, I've sent a letter out to all of our staff just to provide some explanation and reassurance about our approach to redeployment. We'll only do that if absolutely necessary. We would never deploy anybody to an area where you've not got the knowledge and the skills in order to be able to work safely. And our plan is that should we need to redeploy, we've done it in a way which is your manager's already had a conversation with you. We respond to people's preferences and we've matched that up. But just to reiterate, all the planning that we're doing at the moment in how we're reconfiguring our services and prioritising our services is in order to mitigate that as much as possible. But like I say, there is a letter coming out to everybody just to explain a little bit more about that, because I know that's something people just want some more information on. Okay, right, that more or less takes us up to 4 o'clock. Thank you very much, and it's been nice to see people's faces too. So I hope everybody keep yourself safe and well, and I might see you again next week for those of you that dial back in.